Thank you, ladies and gentlemen. We have an amendment to adopt, Madam Chair.
Okay. Representative May moved for adoption of Agreement Number 1 to House Bill 226. All those in favor say aye, opposed nay. The amendment is adopted.
Thank you. Thank you, ladies and gentlemen, for the opportunity to present this. It's the first time that I really presented this bill, although I think the committee has looked at some other versions of this. I can tell you that when we received this bill from the Senate last year, maybe 2 years ago, it had passed unanimously in the Senate. It came to us, and we then proceeded to sit down with some key players. We invited, of course, the State Medical Society, but truthfully spent most of the year working with the Illinois Nurses Association and also with the Advanced Practice Nurses Group. And through that process, this bill has been completely rewritten, and I'm proud to say that this is now one of the strongest pieces of legislation in the entire country. It has, and of course, what we're talking about is Home Birth Safety Act. Let me just begin by saying to you that this is a choice that 800 to 1,000 moms make a year. It's maybe not the choice that anybody on this committee would make to have a home birth. Some people choose it, some don't. What this bill is really about is making sure that we as state legislators have made sure that when there is that choice made to have a home birth for whatever reasons, whether it's religious or cultural or personal or family related, that choice, that there's an access to a healthcare provider who can assure that there's some safety and education and training, and that is a licensed professional. And that's what this bill is trying to do. This is the Home Birth Safety Act. And again, the 5 highlights that I would like to sort of just reinforce before I hand it off to the 3 experts sitting at the table is that we now have strong educational requirements, again, worked out with the advanced practice nurses and INA. They insisted, and this bill is very detailed. Every course that's required, that should be required, is now detailed in this bill. There's extensive informed consent clause, the most detailed informed consent requirement in Illinois healthcare licensure statutes. There's a detailed scope of practice and rules, all defined in the statute. There are strictly limited medications, again, not left to any guesswork. It's all spelled out in the bill. And finally, a formalized collaboration and referral, which is again required with other medical professionals. So again, we're proud that we have received the support of the advanced practice nurses, who in fact are the certified nurse midwives in our state. And also that the Illinois Nurses Association is at this point neutral, but have said that the INA has changed its position from opposed to neutral because they feel the current proposal adequately protects the public, includes sound education and certification requirements, and does allow women to choose to have a licensed certified midwife to provide prenatal and childbirth services in their homes. This is again, a bill that is only applicable to less than 1% of the babies born in Illinois. In the other states that have adopted licensure for midwives, when after licensure, it's not true that more women choose to have home births. It's a very unique segment of our population that decides to do this. But when they do, we should try to provide we should make sure that there's protection and safety for those moms. So with that, let me turn it over now to Ann Gallagher, who is a nurse midwife and a nursing instructor.
Good afternoon. I have 15 years of experience at University of Illinois Hospital, which is a very high-risk center, as a nurse. Also at Illinois Masonic Alternative Birth Center in the hospital. Also in Texas in an out-of-hospital birth center. And I have 15 years as a nurse midwife working with Alivio Medical Center in a very high-volume practice. We had a lot of babies. I worked 4 years in a home birth setting there. And I am an instructor of basic nursing students as well as CPM, a CPM program. And I have been adjunct faculty for nurse midwifery students. So I have 30 years in this field, and what I would working with CPNs. I'd like to give an example of at my hospital, because of a technique I learned, a baby was in distress, the shoulders weren't coming, the cord was cut. The physician was pushing the baby back inside the mother to do a cesarean, and that's called the Zavanelli maneuver. And because of my experience in home birth with CPMs, I was familiar and comfortable with something called the Gaskin maneuver, and was able to convince my physician to turn the woman over and freed the baby immediately. And I honestly believe that that child would not have survived, or at least not with his quality of life. The cord had already been cut for a couple of minutes. To be able to accomplish the section would have taken several more minutes, and the baby had no circulation at that time. So the point that I want to make is the exclusive focus of the CPM on birth, as a, they are experts in natural birth. And no physician will have learned some of those techniques, nor nurse midwife students. You're not exposed to it in a hospital practice in a way. And so they're actually guardians of low-tech, very effective interventions in this natural process. And I think that part of the complications around birth, there is a significant percent that do result from our interventions. So just to be aware of that. And I feel in my working with the students that they are safe practitioners, that they think critically, that their textbooks are, many of them are the same as that I've used. And so just from 30 years of experience working in home birth, seeing the beauty and safety of it, wanting it to keep it as an option for people, I think that we can make it safe for people who choose that.
Thank you very much.
Thank you.